Left versus right. Us versus them. While we pay to keep our politicians fighting, how do we, the people, rise up and solve the great challenges of our time? We do it by embracing freedom and liberty. There may be no such thing as a free lunch, but this hour is as close as it gets. Welcome to A Free Solution.
All right, welcome to A Free Solution. I'm Kevin Wilson, your host for today. Thank you so much for joining us. We're live here on WYSL. That means that you, the listener, can call in, participate in the show. We're here until 1 o'clock. 866-552-1009. That's 866-552-1009. Or if you're listening online on the Free Solution Facebook page, Free Solution YouTube channel, or the Kevin Wilson pages, wherever you're listening, watching today, leave your comment, and we'll address them if you leave a good comment. Shout down the line to our friends over at WACK out in Newark as well. Appreciate y'all listening too. Should have an interesting day today. Today, of course, and if you're listening to WISL before this, you heard some of the news updates with the vaccine mandate for healthcare workers rolling in today. So we're going to spend a good chunk of the show talking about that. Talking about what this means for liberty, what some of these trade-offs are, but I want to kind of pull back and think about this discussion, right? Because and you're gonna have to stick with me for a couple minutes. I promise I'm gonna get to it. But my opposition to mandates is just as much consequential as it is moral, right? So I oppose vaccine mandates. I've said this before. I'm very pro-vaccine, but I don't think that the government should be getting involved in setting mandates. But I also don't think that the government should be getting involved in setting what employer requirements should or shouldn't be in this field too. But I want to kind of bring this to a situation that I'm experiencing. Maybe some of you have experienced this before too. If you've ever been in the position of hiring someone, right? You need to find someone who's going to be a good fit for your job, who's going to serve your clients, your customers well, serve your fellow employees well, someone who's going to be a good part of a team. Now, I'm in this dilemma right now, right? So I'm trying to hire someone for my team, entry-level position. I set what I thought were two easy requirements for applying for this job. And I just said, all right, just send me a resume and then send me one other piece of information, just because I want to see how they're thinking about the topic that they're going to be doing, the substance of what they'll be doing in their day-to-day work. So I said, send these two things. I had many, many, many people apply to this job, but not a single person, not one, actually followed the requirements. No one sent in the other thing, which drives me nuts. So me, as someone who's hiring someone, I've got to make a decision, right? I've got to say, well, what do I need more? Do I need someone who is paying attention to this? I set that requirement in part to show attention to detail in my job. If you accidentally mess up and you're not paying attention, it can cost thousands of dollars, and it can be very costly, not just to the agency, but to the client's business. I need that attention to detail. It's important. And also I just want to see if they had an acumen for the work, right? But the attention to detail is the big thing, right? So now what do I do? What do I do as a person hiring? Do I say that I am going to ignore the fact that not a single applicant did this correctly? And if I do that, what are the costs of that? Will it cost my client money? Will it cost them their business if they mess up big enough? Will it cost the agency money? Will it harm our business? How big of a deal is it for me to hire someone who doesn't meet the requirements for attention to detail that I'm looking for? Now, as an employer, as someone making that hiring decision, I get to do that. I get to decide what the trade-off is. Do I need someone in office more, even if they are imperfect? Do I need that employee so much that I'm willing to overlook that crucial aspect of the job and hire someone anyway? Or do I say, I don't need them that badly? It's more important to get the right people here than to get someone in who doesn't meet the requirements. Now, I say all this to say that if we didn't have a government mandate, if New York State, if Governor Hochul wasn't imposing a mandate on healthcare facilities, these healthcare facilities would have to make these individual decisions too. They could look at the whole scope of the problem and they could say, is it worth imposing a mandate if a significant portion of our employees are going to not comply with it? Is it worth losing those employees over this mandate? And that's not a trade-off that I think that the governor should be making or that, I should be making. That no one but like these employers in unique circumstances that are specific to their communities should be making these decisions. And here's why I say that is because like maybe there's a community where there is a high level of compliance. Most people are just they're willing to get that. And for people who are facing patients themselves, most of those folks are doing that they can impose this mandate while losing very few staff. And those few staff that don't want to comply with that mandate, it's not going to critically damage their services. There are some communities where that's the case. Maybe there's some other communities, and we've seen this with especially rural hospitals, where there are many, many people, mostly like nurses and support staff, who don't want to get the vaccine. And it's a significant enough percentage of their workforce that it will critically damage core parts of their medical operations. Where you've heard stories about some hospitals shutting down entire maternity units because they won't be able to staff them with a vaccine mandate. Now, that's something that seriously damages the community. Is that trade-off worth it? For many of those hospitals, they might say, no, we'd love to solve this problem of getting more people vaccinated, but it's that trade-off isn't worth it to us because it's more important to have that maternity unit than it is to make sure that our employees are vaccinated. And again, I don't know what specific trade-offs are being made in these situations if hospitals and other medical facilities were able to make that on their own. Another facility, they might say, well, we work with a vulnerable population. If you have a cancer center, if you have a long-term care facility where you have people who are medically vulnerable, you might say, yes, it is important that 100% of our employees are vaccinated because without that, that could kill our patients. And they might say it is, even if we lose a bunch of staff, it is worth it because we can't expose patients to this danger. That's a trade-off that hospitals and medical providers ought to be able to make. But unfortunately, the governor hasn't given them a option here. Again, maybe U of R still does the same thing in absence of what the governor says. Maybe a long-term care facility does that too, but maybe a medical facility in I don't know, up in St. Lawrence County or up in Clinton County, New York. Maybe they're not going to do that though. Maybe that's not worth the trade-off to them. And I get it for that's important, right? For in that situation, not having the vaccine in the minds of many medical providers, it exposes their patients to danger. This is more life and death than the situation that I presented that I'm in as hiring someone. But again, I get to make that decision. My agency gets to make that decision. And in this case, when life and death is on the line, when you may lose critical parts of our healthcare infrastructure in some parts of the states where some people just refuse to get vaccines, that is a decision they should be able to make on their own, not something that should be imposed top down from a governor who doesn't understand and cannot possibly understand. It's not anything specific against Governor Hochul in this situation. She cannot possibly understand every situation in every community in New York. She doesn't have enough knowledge. Politicians shouldn't have the hubris to think they have enough knowledge to make a decision about every community and every medical facility in the state. No, they should be able to make it on their own. So my opposition to vaccine mandates, again, isn't just that that governments shouldn't be imposing something where people should be forced to put something into their body if they don't want to. And again, I say this as a pro-vaccine person, but it's also the consequentialist aspect of it too, that they are forcing these medical facilities to make trade-offs that might not make sense in their specific situations, that may harm communities far more than having a certain percentage of staff that are unvaccinated. Maybe in areas that, where there's relatively low risk. That is why that's why we shouldn't be doing things top down. That's why we shouldn't be getting vaccine mandates from Governor Hochul or President Biden or anywhere else. Politicians, political leaders, bureaucrats, they can't know every situation. And it will have a cost for New Yorkers, even if the intentions are good, even if the intention is to protect people. Okay, that's all I got for this segment. Thanks again for joining us here on A Free Solution. Remember, we're live today, so give us a call if you want to weigh on the situation. We're talking about the vaccine mandates for healthcare workers being rolled out today. Give us a call, 866-552-1009. That's 866-552-1009. We'll be back with more on A Free Solution in just a few minutes.
Your business relies on computers and technology to operate. Slow, unreliable networks and servers can cause unplanned downtime and affect your bottom line. The experts at SimpleTech Innovations are here to help. Their preventative maintenance program ensures that your computers and network are kept up to date and monitored for any issues, keeping your business running smoothly. They also help clients achieve HIPAA, PCI, and New York State cybersecurity compliance to keep your network safe and secure. Whatever your business IT needs are, SimpleTech Innovations should be your first call. They've won the Best in Rochester 8 years in a row and have an A+ Better Business Bureau rating. Call them today for a free consultation at 585-200-3182. That's 585-200-3182. SimpleTech Innovations.
Tyranny.
There's going to be no circumstance where you see people being lifted off the roof from Afghanistan.
No one thinks it can happen here.
Shelter in place until and unless you receive a communication from the U.S. Embassy.
And without our God-given right to self-protection as outlined in the Second Amendment, it can. But this fall, you have the opportunity to stand up for freedom. October 8th, 9th, and 10th, celebrate freedom, faith, and family at the Rod of Iron Freedom Festival. It's America's largest festival for Second Amendment advocacy. With Pastor Sean Moon, Sheriff Richard Mack, Olympian Gabby Franco, Dr. John Lott, Teddy Daniels, and very special guest, radio talk show host and patriot Dana Lash. Plus great live music, vendors, fireworks, and you. Tickets are free at rodofironfreedomfestival.org. That's rodofironfreedomfestival.org. Join us to celebrate freedom.
Why do businesses choose to move their website from Wix and Squarespace to SimpleTech Innovations? Maybe it's their excellent customer service or attention to detail. Maybe it's their ability to give a truly customized solution. Or perhaps they just like the fact that SimpleTech is a local small business that builds great relationships with its clients. Whatever the reason may be, you can rest assured knowing that the local team at SimpleTech has your best interest in mind when building or updating your website. They're hands-on and love helping customers achieve their goals. But don't take my word for it. They've won the Best in Rochester 8 years in a row and have an A+ Better Business Bureau rating. If your website doesn't match your dreams or isn't achieving your goals, give the professionals at SimpleTech Innovations a call today for a consultation at 585-200-3182. That's 585-200-3182. SimpleTech Innovations.
A free solution.
Welcome back to A Free Solution. I'm Kevin Wilson, your host for today. Thanks again for joining us again. We're live here until 1 p.m. on WSL. Give us a call, 866-552-1009. That's 866-552-1009. Or just call station number 585-346-3000. Call either one of those. It's fine. Or leave your comments online if you're listening on our Free Solution Facebook page, YouTube channel, or the Kevin Wilson pages, wherever you're listening today. Again, thank you for being here. We're talking about the mandate, the vaccine mandate, the COVID-19 vaccine mandate for healthcare workers rolling out today. And again, I want to talk more about the consequences of it than the morals of it. I feel like we've kind of hit the morals of it on the show quite a bit. And because part of my belief in liberty, part of my belief in limiting government, as I talked about last segment, isn't merely that it is the right thing to do from a moral perspective. It's also the correct thing to do from achieving the best consequences for achieving the best outcomes by distributing knowledge, right? You don't need that top-down approach, and oftentimes that top-down approach doesn't consider the consequences of their action on a diverse set of communities, that someone way up in Albany or in Washington, D.C. or whatever cannot possibly understand on individuals and employers. But it's going to be interesting to see, how this affects the Rochester area specifically. We've already seen, some of the hospitals in the area start to say that once again they're going to start pausing elective surgeries. They might, limit some services, and so it seems as if they're anticipating that there's going to be a high rate of people who are going to choose not to get vaccinated, knowing that they may lose their jobs over it. And it's going to be interesting to see if there's going to be any more court cases over that. I legitimately have no idea if anything like that would be successful, because the thing is there's a legal precedent for vaccine requirements for employers, some of which are required by the state. You kind of see this in some childcare settings and healthcare settings and things like that. So it's not like vaccine requirements are a new thing. It's just a specific opposition to the COVID-19 vaccine, and whether or not these circumstances ought to allow more people to get exemptions. Because I think that even in an area where there's a lot of folks who are getting vaccinated, vast majority of doctors and nurses are getting vaccinated, but you still have if you have 10%, I don't know what the actual number, but you have 10% of nurses who don't get vaccinated or are suddenly out of the workforce, in a workforce that's already stretched thin because a lot of nurses and support staff have just been burned out. Again, talking with folks that just burned out from doing this for a year and a half. People are tired. They, and they just figure, man, it's not worth the cost to their health, mental health, and time with family, things like that, for what they're getting paid to do their jobs. And again, that's not the attitude of most folks. Most people are grinding it out. They're doing what they can. They're helping people, saving lives. And so those types of folks, the ones who aren't getting vaccinated, does it make sense for those folks who've been working hard in this system to be let go today? Will employers follow through? Will employers say, like, yeah, no, we're going to comply with the state, and this is your last day? I don't know what's going to happen. That's going to be the interesting thing as we go through this week. What hospital systems will be left short-staffed? What ones will try to fight the state on this? I don't know. And that's my worry about when we get these top-down mandates. Now, so what's interesting is that Governor Hochul has proposed a couple of solutions to maybe combat this. She's saying she's going to roll out some new executive orders for this, some of which I actually like. And I caught some flack for this on my Facebook page over the weekend, but let's talk about the ones I don't like. I don't like bringing in the National Guard to do this. Same thing with I didn't really like we have to bring in the National Guard for the bus driver shortage too. I mean, this is a problem created by government. Again, didn't consider the trade-offs of implementing this requirement on both schools and hospitals, and is now trying to solve that by compelling people who are in service of the National Guard to go and fill in the ranks here. That's not a stable long-term solution. I know it's being in the National Guard is a little bit different. Being in any service like that, the vaccine requirements are also very strict. So it's going to be interesting to see how that's playing out there too. I honestly do not know much about how the vaccine requirements are playing out on either military or National Guard service, but that seems to be Governor Hochul's go-to solution is like, well, I can order these people to go and serve hospitals. I can order these people to go and drive buses. So I'm going to do that. She has people at her command, and that's the solution. But us normal folks, we are not at her command. And again, instead of trying to convince people, that's they're using force in this case. But the one part of it I do like, the one part of her executive order that is actually a redo of a Cuomo executive order. One of the few things that I actually liked about that guy is they are lifting requirements for medical workers who are licensed in other states or in other countries. Now you no longer need to go and get recertified in New York State, go through that whole rigmarole. You can just come in if you have medical licenses in other states. And actually, I think this is a great thing. I think that there is no reason we should create these artificial barriers in, especially within the United States. It doesn't make sense for me. I'm pretty sure if there's a doctor like who's doing a decent job in Pennsylvania, they should easily be able to come over to New York and start working right away without it being like a massive bureaucratic hurdle. I think this is a good thing. We should do more of this. Governor Cuomo did this again during the height of the pandemic to try to attract more workers. Now, I know some people say, no, they're only doing this, they're only deregulating this thing because of the temporary emergency created by the vaccine mandate. And yes, y'all, I know that. I understand that. I get what that is. But whenever Democrats start to say, well, you know what? If we're having issues with serving our communities with healthcare, you know what we can do? We can remove these artificial barriers to entry. We can remove these regulations. We can remove these extra licensing requirements. And suddenly we're able to attract the employees to meet that community need. What a great thing. Yeah, if you have licensing reform, if you have regulatory reform, it becomes easier to attract the type of employees that you need in New York State. Now, gosh, if only we could apply this lesson absolutely everywhere and not do it only in response to a self-created emergency. If Governor Hochul, I really doubt she's listening to a free solution, or if she was, she would be implementing way different policies. But if Governor Hochul could learn that lesson, if the Democrats could learn that lesson, my goodness, if the Republicans could learn that lesson, we would be in a much better position as a state to have jobs for people who need them by lowering these barriers when they don't need to be there. Again, people who are gone to medical school, who have become doctors, who have gotten certified in other states, it's difficult for them to come in and do that in New York State. If they're same with another country, if someone is serving as a doctor in France, I'm pretty sure we shouldn't create huge barriers to entry for them coming in and serving as a doctor in the US, or they're serving as doctor in South America, whatever. It doesn't matter. We should be able to make that process as easy and simple as possible. And I get that they're lifting that to bring in more workers in response to the vaccine mandate. But this is a good thing. And this is something that people who are liberty-minded should push to keep. Again, separate from the vaccine mandate. People say you can't separate that. I can separate that. Separate from the vaccine mandate. We should just keep doing this because it's good in its own right. And there's no reason to create these artificial barriers for intelligent people to be able to come to New York. I'm a blessing for wanting to come to New York in the first place. Maybe they don't know. Maybe they love a lot about the state and don't know much about the government, but I'm glad they're coming here. If they want to come here and serve in our hospitals and live in our communities, great. Let's bring them in. Why would we not want to? It's good news. All right. Thanks again for joining us here on A Free Solution. We're going to be back with a little bit more right after the break. But if you want to call in, participate, weigh in on the vaccine mandate for healthcare workers, give us a call, 866-552-1009. That's 866-552-1009. We're going to be back in just a few minutes.
Fly the flag, stand for freedom.
WYSL.
AM 1040 Avon Rochester, FM 92.1 Rochester, and FM 95.5 Spencerport.
Here's the latest forecast from the Newstead NBC Weather Center for tonight. We'll see some increasing clouds. Could be a spot shower late. Temperatures in the 50s on your Tuesday. An early morning shower. Some clouds will linger. They'll clear up in the afternoon. Much cooler breeze out of the north. Only in the low 60s on Tuesday. Wednesday should feature partly sunny skies. Temperatures in the 60s. I'm Rich Canilia, WYSL.
Hi, this is Gary Mervis, founder of Camp Good Days. September is Prostate Cancer Awareness Month, and I want to encourage all men, especially those that are 50 and older, to talk to their physician about their prostate health. As men, we don't typically think about our prostate or what it even does until it becomes a problem. Speaking from personal experience, I can tell you that keeping track of your prostate health should be a priority. In order to make sure your prostate is in good shape, your doctor can give a digital exam or order a simple blood test to check your PSA levels. If something is wrong, the best option is to get answers is a biopsy. Prostate cancer is one of the most frequently diagnosed cancer and second leading cause of cancer death in American men. It's very treatable if caught early enough. However, the best form of treatment is being proactive with your doctor. Camp Good Days hosted a number of men's prostate cancer retreats. With the help of Dr. Gene Joseph, chair of the Department of Urology at the University of Rochester, and Louis Eichel, chief of urology at the division in Rochester General Hospital. For more information, call our office at 624-5555 or visit campgooddays.org.
Why do businesses choose to move their website from Wix and Squarespace to SimpleTech Innovations? Maybe it's their excellent customer service or attention to detail. Maybe it's their ability to give a truly customized solution. Or perhaps they just like the fact that SimpleTech is a local small business that builds great relationships with its clients. Whatever the reason may be, you can rest assured knowing that the local team at SimpleTech has your best interest in mind when building or updating your website. They're hands-on and love helping customers achieve their goals. But don't take my word for it. They've won the best in Rochester 8 years in a row and have an A+ Better Business Bureau rating. If your website doesn't match your dreams or isn't achieving your goals, give the professionals at SimpleTech Innovations a call today for a consultation at 585-200-3182. That's 585-200-3182. SimpleTech Innovations.
Springwater Amish Workshop reminds you, just like that, harvest time, fall, and hunting season are upon us. See the great 12-point hunting blind featuring quiet glide windows, full insulation, smart siding exterior, and now on display at the Springwater Amish Workshop store, Route 15 in Springwater. The store has other goodies to decorate your home and lawn for fall. Don't forget, outdoor lawn furniture makes outstanding Christmas gifts for mom and dad and a great surprise for your wife or husband. We'll store it for you until Christmas. We're your headquarters for storage buildings. They can be delivered to your prepared site all winter long. Springwater Amish Workshop, 7936 Route 15 in Springwater. Open Monday through Friday, 9 a.m. to 5 p.m., Saturday, 9 a.m. to 3 p.m. Visit SpringwaterAmishWorkshop.com or visit them on Facebook, 585-669-9710.
Within every Roberts Wesleyan College student athlete is a transformation story in the making. As the only NCAA Division II school in the greater Rochester area, student athletes are guided by dedicated and experienced coaches and staff. You can pursue your athletic interests and shape your future forward as a Red Hawk at Roberts. Discover more about competing as an NCAA Division II student athlete and receiving a Christ-centered education at roberts.edu/greater story.
By the time you get your deck ready for the season, cleaning, repairing, staining, or painting, summer's nearly over. Never again. Let Burt's Lumber & Perry introduce you to Duralife composite decking. Never needs painting or staining. Just put it up and enjoy life on your deck. And Burt's Lumber & Perry has Western New York's largest inventory of Duralife decking. 4 colors to choose from: mahogany, coastal gray, teak, or walnut. Duralife composite decking from Burt's Lumber & Perry. Open 7 days a week, including Sundays, 9 to 1.
At Veterans Outreach Center, we do so much more than just provide services for veterans. Our one-stop shop model means that we provide a life-changing experience to our nation's heroes. If you're a veteran looking to change your life or even just to connect with other vets, contact us today at 585-546-1081 or online at vocroc.org. Veterans Outreach Center, serving those who serve us.
A free solution. A free solution.
Welcome back to A Free Solution. I'm Kevin Wilson, your host for today. Thanks again for joining us. We're live here on WYSL, which means that you, the listener, again, can call in 866-552-1009. That's 866-552-1009, or leave your comments online. I'll read this one from Brian. Hey, Brian, you've left me some good, interesting comments before this one. He says, saw someone compare COVID-19 passports to the mark of the beast in Revelation, so you won't be able to do anything without it. I don't know about the mark of the beast, man. I'm not gonna get into that. But yeah, no, you might need COVID-19 passports for a lot of your activities. That people are still freaked out by this, and that that's to me. I don't fall in line with the Republican status down in like Florida and a few of the other states where they want to ban these things, because I think if you're a business, you should be able to set these requirements for yourself. But I don't like when the government is the one imposing these requirements, as they are in New York City, where they say that every single person needs to be vaccinated and prove it to access goods and services. There are greater consequences to that than I think the designers of these plans realize. And just as I said in the previous two segments, there's not just a moral opposition to this, but there's a consequential opposition to this. And for the type of folks who are imposing these requirements in New York City, for instance, they have to grapple with the fact that they've tried to position themselves as the ones pushing for racial justice, the ones pushing for social justice. And unfortunately, there's still a relatively low vaccination rate among some communities of color. And that being the case, you are now excluding a good chunk of those communities from goods and services. And yeah, so Brian says, I'm not commenting on the validity of the comparison, just that's an interesting comparison. Yeah, maybe again, mark of the beast being you have to. I don't think that this is it. By the way, not that I want to get. I don't think that this is the mark of the beast or whatever. I have the vaccine. I'm pro-vaccine. I think that there's a good reason to get vaccines generally, and this one specifically, because I did research on this and came to a conclusion that this made sense for me. And I hope you talk to your doctors and do the same thing, and you figure out like whether or not the vaccine's right for you. But I don't like the vaccine passport system all that much when it's required by the state. If private businesses want to do that, that's their prerogative. They can do what they want in terms of deciding who gets to come to their business based on protecting their employees and customers. And a lot of businesses are doing this, by the way. They want the vaccine passports in part because their employees are demanding it, because they are saying, well, I don't want to have to go into work and be exposed to illness. I'm not getting paid enough for this. But if you want to keep me, you have to reduce my risk while being here. And so even if they're vaccinated, they're worried about their own breakthrough cases and whatnot too. And Brian, I know you're not commenting on the vax itself, just the vaccine passports. That's what I'm trying to do too. But I'm just qualifying that with what's happening. And got another comment from Nate on YouTube. He says, why is the mainstream media ignoring what is going on in Australia with the lockdowns and the mass arrests, protests, etc.? Scary stuff going on over there. Yeah, absolutely, Nate. Like that type of stuff, like that's like the kind of unrestrained end game of some of the people who are letting like the COVID fear like completely run wild in their minds, right? And again, I feel like I'm a moderate on most of this stuff. Like I recognize the danger and recognize that there are trade-offs here, but there's some folks who are still, they're talking about like, so what's going on in Australia is they figured, well, we're an island, we have I forget what they're called down there, but basically states. They have individual states, just like the United States has states. Australia has that too. And within these states, they've tried to completely eliminate COVID. They've tried to make it non-existent there. And to some extent, they've sort of succeeded, right? Like there has not been COVID in some places. Like I've heard, like around Perth, which is a city that is absolutely in the middle of nowhere. It's weird that it exists, but they basically have nothing going on there COVID wise. But the trade-off for that is that in Australia, you have to go and check in at every single restaurant that you go to for contact tracing. And then they have things like, if you're in quarantine, you have to take a picture of your face and send geolocation whenever they ask for you to make sure that you are obeying the quarantine orders. They also have camps for people, which, if you believe some of the Australians, they say, oh, the camps are nicer than the hotels, but they're still putting people and forcing people in the hotels for a couple weeks at a time. And you're not allowed to travel between states, and you're not really allowed to leave Australia. And and another, I'll read this comment too. It says sarcasm: Australia, a penal colony acting like thugs. Go figure. But yeah, no, I mean, it's what Australia's kind of gone back to like a prison state. And I know there's like there's a good interview on the Fifth Column podcast with the guy from Australia giving the pro side of like their way too far lockdown figures. But man, like it seems insane to me to try to be in the mindset of we're going to completely eliminate this disease, like in totality. And in some areas, like you just can't do that. The trade-offs are too great. You're shutting down tons of businesses. You are not letting people travel outside the country. You're not letting people travel between the states. They're bordering off those because the virus might spread between the states. So they're locking them down. Because whatever state Perth is in, whatever state Tasmania is in, they want to be hard lockdown. The one that was it Melbourne is in, the big city down there. They're a little bit more recognizing some of the trade-offs that are going to have to happen, and that they may, like the rest of the world, have to deal with COVID as an endemic disease. But would you want to check in everywhere? Would you want to prove your vaccine status absolutely everywhere? Every single restaurant, store, stadium you go into? How long are you going to do that? Is it going to be forever? I think it was a Connor Friersdorf's article that talked about some of this stuff. Like, can Australia continue to call itself a liberal democracy in a situation where they've decided that any liberty is up on the chopping block in order to prevent even a single person from getting sick? That they don't consider any of those trade-offs. They will shut down everything, and that you can't go outside in some places. You can't, even if you're vaccinated, you still can't go outside. And again, in that podcast I referenced, they say, oh, it's not that bad. They don't enforce it, but they could if you have a law in the book and they can enforce it. And then you see some of these protests. And again, I can't comment on all of them because I see like a lot of people sharing like, oh my goodness, look at what's going on in Australia. And it turns out some like protests from like Canada or something. And so if you have videos, they'll send me, but it looks like, it seems like there are some videos that seem credible of Australian police and going and chasing people down for like not complying with, like masking, vaccination stuff, going outside type of stuff. And that's, goodness, do we really want to live in a country like that? And I think most Americans at least have said, no, that's way too far. You have a few on the fringe, usually almost always on the left in this case, but the fringe are like, yeah, like that's what we got to do if it saves just one life. No, man, we cannot sacrifice every single liberty for this disease. We have to make the trade-off. There are dangers in every single thing that we do. There are dangers when we go out and drive to the store. There are dangers when we walk down the street, for goodness sakes. We don't need the government micromanaging every single aspect of our lives in order to prevent one person somewhere from getting sick. It's not to say that we shouldn't make some of those trade-offs, but Australia, man, you guys have gone way too far. I doubt there's any Australian listeners of this show, but that is a warning. That is a canary in the coal mine for if we let the rabid lockdown side run amok. I'm for taking COVID seriously. Still, I'm for doing a bunch of stuff, and by we I mean not the government, but like us as individuals. But my goodness, if you let the government run away with that stuff, look what they'll do. Absolutely wild. All right, thanks again for joining us here on A Free Solution. We got one more segment coming up left. If you want to talk to us, talk to me, give us a call, 866-552-1009. That's 866-552-1009. We'll be here till 1 o'clock. Talk to you then.
Why do businesses choose to move their website from Wix and Squarespace to SimpleTech Innovations? Maybe it's their excellent customer service or attention to detail. Maybe it's their ability to give a truly customized solution. Or perhaps they just like the fact that SimpleTech is a local small business that builds great relationships with its clients. Whatever the reason may be, you can rest assured knowing that the local team at SimpleTech has your best interest in mind when building or updating your website. They're hands-on and love helping customers achieve their goals. But don't take my word for it. They've won the best in Rochester 8 years in a row and have an A+ Better Business Bureau rating. If your website doesn't match your dreams or isn't achieving your goals, give the professionals at SimpleTech Innovations a call today for a consultation at 585-200-3182. That's 585-200-3182. SimpleTech Innovations.
Tyranny.
There's going to be no circumstance where you see people being lifted off the roof from Afghanistan.
No one thinks it can happen here.
Shelter in place until and unless you receive a communication from the U.S. Embassy.
And without our God-given right to self-protection as outlined in the Second Amendment, it can. But this fall, you have the opportunity to stand up for freedom. October 8th, 9th, and 10th, celebrate freedom, faith, and family at the Rod of Iron Freedom Festival. It's America's largest festival for Second Amendment advocacy. With Pastor Sean Moon, Sheriff Richard Mack, Olympian Gabby Franco, Dr. John Lott, Teddy Daniels, and very special guest, radio talk show host and patriot Dana Lash. Plus great live music, vendors, fireworks, and you. Tickets are free at rodofironfreedomfestival.org. That's rodofironfreedomfestival.org. Join us to celebrate freedom.
Your business relies on computers and technology to operate. Slow, unreliable networks and servers can cause unplanned downtime and affect your bottom line. The experts at SimpleTech Innovations are here to help. Their preventative maintenance program ensures that your computers and network are kept up to date and monitored for any issues, keeping your business running smoothly. They also help clients achieve HIPAA, PCI, and New York State cybersecurity compliance to keep your network safe and secure. Whatever your business IT needs are, SimpleTech Innovations should be your first call. They've won the best in Rochester 8 years in a row and have an A+ Better Business Bureau rating. Call them today for a free consultation at 585-200-3182. That's 585-200-3182. SimpleTech Innovations.
A free solution.
Welcome back to A Free Solution. I'm Kevin Wilson, your host for today. Thanks so much for joining us. Appreciate y'all being here. Again, we're live on WISL until 1 o'clock. Give us a call, 866-552-1009, 866-552-1009. If you want to participate, chat with me live on air, or leave a message to our producer, either one. Shout out that line to our friends over at WACK out in Newark, listening a little bit later. And shout out to our friends listening online, too. Very active in the comments today, folks. Whether you're on the Kevin Wilson page, Kevin Wilson Twitter account, or the Free Solution Facebook page or YouTube channel, wherever you are. Appreciate y'all listening today. Appreciate y'all engaging with it. And one more comment from Brian, because this is a good one. They are treating liberties as a gift from government. You're darn right. That that's liberties. Your liberty is not a gift from government. The government doesn't give it to you. The government, in fact, doesn't give you liberty through the Bill of Rights. They don't give you freedom of speech. They don't give you the right to bear arms. They don't give you the right to be secure in your persons of paper. You already have that. Is you, however you want to spin it, God-given, natural, intrinsic, you have that liberty. Government only takes those things away. And the Constitution, it doesn't give you that liberty. They just define that the government cannot take away that liberty. They clarify that the government can't take away your right to bear arms. They clarify the government can't take away your right to free speech. That's what the Constitution does. In Australia, liberties are not there to be given away or taken from you by the government, by even a majority of people if they vote on it. That's not how liberty works. It's inherent to you. You have it no matter what, regardless of what the government says. All right, anyway, that's my philosophical soapbox for today. And actually, I'm gonna pitch one more philosophical question. I'm not gonna answer today. I pitched this on my Facebook page too, and I could see a few folks answering this. And that's, do you, the individual, the folks listening to the show, do you have the right to take an action that puts others in danger? I'll leave it at that. Do you have the right to take an action? And this is just a philosophical question I'm kicking around with, but I think it's relevant to a bunch of public policy debates. So maybe I'll do something on this next Monday. The new schedule as it seems to be working out, folks. So I'm again on Monday, Wednesday, Friday. Wednesdays I'll be with Andrew, and Fridays I'll be on with Tim. Mondays I'm probably going to do solos. Sometimes I'll have guests on, but that's something I'm thinking about lately. So jump over to my Facebook page, the Kevin Wilson Facebook page. Go in the comments there, think about that question, give your answer. Maybe we'll talk about that as Monday's show. But okay, so I'm gonna leave the vaccination discussion for the last little bit, unless we get anyone to call in. I'll jump back to it if anyone calls in. Again, 866-552-1009. But there's a couple other topics that I wanted to hit on really quick. So one is, it's interesting to me that there's a lot of stuff that is going on in Congress, right? Like a lot of laws that I think Wednesday I might spend a little bit more time maybe talking with Andrew about the red flag laws we saw. Unfortunately, a lot of Republicans voted for that bill too. We'll dive into that. There's also another bill that I thought was interesting, which was, it was an amendment to the spending bill, and it was to cut defense spending 10% across the board, except for personnel pay, which I know that a lot of the military is personnel pay, but there's a lot of it, like equipment appropriations, a whole bunch of stuff. But the cut it 10%, which would really bring things back to like 2018, 2019 levels. So still a lot of money. Still billions and billions of dollars in defense appropriations, making up a massive amount of our budget. But what surprised me was who sponsored this bill. It wasn't, a diehard sort of libertarian like Thomas Massey. No, it was Congresswoman Alexandria Ocasio-Cortez. And it's funny because Tim and I were talking about her, because every once in a while she does something where I'm like, oh, actually, I agree with that. That's a good thing. Cut 10% spending. Why not? We are spending way too much on this. Like, we have just ended the war in Afghanistan. We should be cutting back on this, because that is where most of our debt is going. It's not going to welfare spending. It's going to the military spending. Not that welfare spending ain't worth tackling, but a lot of that money is in military spending. Went on a rant about this, whatever, last week when someone called in. But look, AOC is the one who sponsored this. Now, disappointingly, folks like Thomas Massey and a whole bunch of former Tea Party folks, I'm calling them former Tea Party folks. They might have came in on the Tea Party wave, but the type of folks who used to claim that they were concerned about debt and deficits, we're going to be raising the debt ceiling again. It might have already happened. I didn't keep track of the debt ceiling vote, but we're going to raise this again. But I remember back in the day, back when I was like an intern for Congress, when that was a big deal, raising the debt ceiling for a moment there that Republicans seemed like they wanted to care about how much money we were spending, how much debt we were taking on, how much that's going to impact future generations. And here we had this opportunity to cut spending, and suddenly, not a priority. Not a single Republican voted for it. All right. Sounds like we have a caller on the line, though. Steve from Rochester. Steve, what's on your mind?
Hey, how you doing?
Good. What's up, Steve?
Hey, the reason I call, I was listening. You're talking about the whole thing about endangering somebody else, and I kind of figured you were referring to the whole vaccine debate, correct?
Could be. Yeah, that's one thing where it applies. But yeah, what's your thoughts on that, Steve?
Well, no, you don't need it. But in this whole other debate, there's no proof that uns versus vaccinated, and it's from one to the other.
Steve, I want to give you the ability to make this full argument, but like you're gonna have to go to a spot where you got bad signal. Like half of what you're saying is getting cut out, man. I'm so sorry.
Oh, I'm sorry. Yeah, I'm on a cell phone. But what I'm saying is that there is no proof that unvaccinated versus vaccinated pose either any more of a danger.
Okay. So I can work with that. I can get that. So yeah, I mean that's part of the debate, right? So like, is there a justification for making laws? Okay, you've seen where I'm going, for making laws if your action or decisions or inaction are exposing other people to danger. And that's the argument that people are building for vaccine mandates, right? And so you're saying, but if you're going to make that argument, to your point, you need to really prove that there's a danger that is imposed on other people from your decision, right? So are people who are unvaccinated putting people in danger because of that decision? Are they exposing more people to risk of getting COVID-19 because of that? And so if you're going to make go ahead.
When it comes to the work environment and the mandating and everything and the whole cure, if you're going to force people into it, then don't you have to also, what if you cohabitate somebody who's at work and is vaccinated? What if they cohabitate with somebody who's not?
Mm-hmm.
Isn't that the same thing as working next to somebody who's not?
It was close, right? I mean, like maybe not close. So like you're still. It looks like you're less likely to get COVID in the first place if you're vaccinated, but it's not zero, right? Like it's not like you can't get it at all, that you can't spread it at all. It just reduces the risk. So yeah, that's a fair question. I'm sure other folks are asking that and considering that. And do they have the right to do that? Well, it seems like probably not. Steve, I'm running out of time though. I appreciate the call.
Fine.
Thank you so much for calling in today and weighing in on that question.
All right, cool. Have a great day.
Yeah, you too, sir. All right, so yeah, that about wraps up the hour though, folks. Again, Larry Sharp is going to be in tomorrow. Of course, I will be back in on Wednesday, hanging out with Andrew Hollister, and then back in on Friday after that. Which, actually, it might be no, it's not a Liberty Show. Oh, it is a Liberty Show Friday, October 1st. All right, so thanks again for joining us here on A Free Solution. I'll talk to you Wednesday.
Celebrate the bountiful Western New York harvest at the Agricultural Fair October